Dear colleagues, welcome. I want to summarize a very recent presentation from this year's Heart Failure Congress in Serbia 2025, and it has been presented by Johann Bauersachs in the late-breaking trial sessions, and it is about sudden cardiac arrest in patient with newly diagnosed non-ischemic cardiomyopathy or myocardial infarction, the SCD PROTECT project. And this was a very interesting nationwide analysis of more than 19,000 patients with a wearable cardioverter defibrillator and newly diagnosed heart failure. And the rationale of this study was to detect the incidence of sudden cardiac arrest or sudden cardiac death in this early phase after MI or in newly diagnosed non-ischemic cardiomyopathy. And this was an interesting project because it is an epidemiological study including all patients in Germany equipped with a WCD within a certain time frame from 2021 to 2023. So all consecutive enrollments of more than 19,000 patients. And the primary outcome was the incidence of sudden cardiac arrests defined by appropriate WCD therapies and reported as first the cumulative incidence and the incidence density of these events. And there were, as I said, 19,598 patients aged 60 years in mean. And the ejection fraction in this early phase of heart failure was 27% on average. And the primary endpoint was the cumulative sudden cardiac death and sudden cardiac arrest incidence, and it was 6.53 per 100 patient years in patients with non-ischemic cardiomyopathy, and slightly more, 9.18 per 100 patient years in myocardial infarction patients. And the time to the first appropriate therapy was really the very early phase, so the first days and weeks of newly diagnosed heart failure. And the authors concluded that this is, to date, the largest nationwide WCD population analyzed in this analysis. And the risk for sudden cardiac arrest and WCD therapies was high during this early phase of medical treatment optimization for reduced ejection fraction in these patients, and this held true for NICM and ICM patients. And the incidence was even considerably higher than we saw in some ICD trials with chronic HFrEF patients. And this is a new finding. And therefore, the authors conclude that temporary protection from sudden cardiac death for patients in this early phase with a newly diagnosed reduced ejection fraction for NICM and ICM during the medical treatment optimization is reasonable. Thank you very much.